Hepatitis C often exhibits no symptoms, and in the U.S., about 50% of the people living with the disease don't know they have it. I'm Julia Walters with Kingman Regional Medical Center, and I'm here today with Dr. Linda Williams, pharmacist and director of KRMC's pharmacy, and Kristen Nelson-Rowan, nurse disease coordinator. We're here to talk about World Hepatitis Day and KRMC's Hepatitis C Program. Thank you for being with us.
Thank you so much for having us here.
So we're here to talk about World Hepatitis Day. Can you just briefly describe what that is for us?
World Hepatitis Day is one of 9 recognized public health diseases by the World Health Organization, and it is to raise awareness, promote testing, and encourage treatment.
So this, of course, is a good time for us to discuss a program that's been a long time coming with KRMC, and that is the Hepatitis C Program through the Disease Management Clinic. Can you tell us about the program?
Yes, absolutely. Is it okay if I talk about hepatitis C first?
Mm-hmm.
Great. What I want to make sure everyone knows is that hepatitis C is a virus. And what happens when you get this from blood, which is transmitted by blood, it causes inflammation in the liver. And without treating that, long-term inflammation can cause scarring in the liver, as well as liver failure, and potentially even liver cancer. Hepatitis C can get transmitted through the blood. And the major ways that hepatitis C can get transmitted is by using drugs that are injected, shared equipment for these drugs, as well as unprotected sex. Also rarely, this hepatitis C disease can be transmitted from a mother who is pregnant to her child.
Dr. Williams, can you tell us and the community why this program is so important to have in this county?
Absolutely. So if you do not know, Mojave County has the highest incidence of hepatitis C within the entire state. We're designated as one of the top 250 counties with a high incidence of hepatitis C in the entire United States. We need to do something. And as you may know, in our rural community, there's gaps in access to care. And right now, there's not one specific way where when a patient thinks they might have Hep C or has Hep C, where do they go? What do they do? What are the resources? And that's exactly why we have this Hepatitis C program here at KRMC. Hepatitis C program includes a multidisciplinary team, and that includes our medical director, Dr. Richard Manch, hepatologist, as well as a team of pharmacists and our wonderful nurse disease care coordinator, Kristen. What this means is that when you, and I'll talk about the process, what this means is that when a patient finds out that they need any type of support for hepatitis C, be it screening, maybe not really understanding what it means, maybe finding that you're positive at a health fair, at an event. What we want to do is make sure that you get that support here. And we want to connect you to all the resources that we have all the way from the beginning when you're first learning that you may have hepatitis C, through understanding what the disease is, as well as treatment, getting your medications, getting the appropriate labs, and making sure that you are cured.
I just want to reiterate that, Dr. Williams, I think a lot of people don't realize that you can be cured if you have hepatitis C. It's not just something that can only be managed and treated. There is a cure.
Currently, we have some great new cures out there. We use oral medication, and in most cases can be in 8 or 12 weeks of treatment. And they tend to have very little to no side effects.
So, Kristen, we said earlier people can have no symptoms and still have hepatitis C. So who should get tested?
The World Health Organization recommends that everybody over the age of 18 gets tested at least once in their lifetime, and then annually if they continue to have high risk for the disease. So whether that's continued use of, IV drug needles and supplies, or sex with an infected individual.
So if someone does need to be tested, how would they get that testing done?
It's very simple. You can just go to your primary care provider and you can just ask for the screening for hepatitis. In the hepatitis panel, it also includes screening for hepatitis A and B. to make sure that you got vaccinated as a child and that you have that immunity. And with that hepatitis blood test, it will check your if you have any antibodies to hepatitis C, which would show that you've been infected. And then with that, they will do a repeat and check for a viral load, which tells us if you have an active disease.
Okay, so then can we talk about what happens if you are positive and you find out through testing that you do have hepatitis C? What happens next?
Once you have found out that you are positive for hepatitis C, then we want to make sure that your primary care provider makes a referral to the KRMC Disease Management Clinic. Once we get that referral, we'll quickly contact you to let you know all about the next steps, and that will most likely be Kristen, our disease care coordinator. What happens before you do get seen by a pharmacist here is that there will be certain labs as well as questions and paperwork to complete. Once you've completed your testing and paperwork, a pharmacist will be contacting you to provide more education about the disease, hepatitis C, as well as the treatment options. Once we gather all that information, we meet with Dr. Manj, our medical director, on the most appropriate path to move forward regarding your treatment plan. We'll be working together as a team to ensure that you understand everything every step of the way. Kristen did mention that the typical treatments are 8 to 12 weeks long, and in some cases, it can even go up to 24 weeks. However, unlike the past, if you have heard from your grandpa, from your other friends, it is not the treatment of the past. This is a medication that is a pill. It is a pill taken by mouth, and depending on which medication is right for you, it will be actually quite simple. What I do want to talk about is that these medications have very little side effects to them. However, we want to make sure that you let us know exactly what else you're taking in terms of your medications, herbal dietary supplements, because there can be some interactions. I want to emphasize that hepatitis C can be cured. The medication options out there have a very high success rate if it is taken appropriately. If you have any questions at all, do not hesitate to reach out to us. We will make sure that we are there with you every step of the way.
Since our program began in January, we have had people successfully complete their treatment and are cured from hepatitis C.
I want to thank Dr. Williams and Kristen again for being here with us to talk about hepatitis C and to talk about World Hepatitis Day. If you'd like to learn more about the program, visit our website at azkrmc.com/hepatitis-C-program, or you can call our hotline at 928-263-HEP-C. That's 928-263-4372.